Hello, my name is Patrick McKeown. I'm from Ireland and I have got a personal interest in asthma. I had asthma myself for about 20 years before I discovered the link between chronic overbreathing, dysfunctional breathing habits and asthma. I was lucky enough to hear of the Buteyko Method. I applied the Buteyko Method to my own asthma and it made a tremendous difference to my quality of health. What are we looking at? We're looking at hyperventilation or overbreathing. And overbreathing basically means that we're breathing in excess of metabolic requirements of the body at that time. In other words, we're breathing too much. People with asthma, we breathe too much. And the typical features of this include breathing through the mouth, hearing your breathing during rest, sighing, regular sniffing, because of course rhinitis, which is of course very common with asthma, taking large breaths prior to talking, yawning with big breaths, upper chest movement, and just visible movement. So it's not as if the person is having an asthma attack. We're talking about breathing volume in excess of normal metabolic requirements, but yet it's quite subtle. And you know, most asthmatics, certainly in my experience of them coming into my clinics, certainly they breathe through their mouths. When we look at minute volume of a person with asthma is between 10 and 15 litres of air per minute. With sleep apnea, which too is common with asthma, also we have say 10 to 15 litres of air per minute. But we know that normal breathing volume is 4 to 6. So we should be breathing 4 to 6 litres of air per minute, but yet an individual with asthma is breathing 2 to 3 times that amount. Now, when we breathe excessively, we often breathe through the mouth. And by breathing through the mouth, we bypass a gas called nitric oxide. Nitric oxide, even though it's produced inside the blood vessels, is also produced and released into the nasal cavity. So it's produced in the paranasal sinuses, it's released into the nasal cavity, and when we breathe through the nose, we carry nitric oxide into the lungs. And nitric oxide is released in the nasal airways in humans, and during inspiration through the nose, this NO, it follows the airstream to the lower lungs, through the lower airways, and to the lungs. And nitric oxide plays an important role in vasoregulation. What I mean by that is that it plays a role in opening and closing of blood vessels. It plays a role in homeostasis, and by that it means keeping the body in balance. It plays a role in neurotransmission, and that's with the brain cells communicating with each other, in immune defense, and also in respiration. If we have a respiratory complaint, it just doesn't make sense to breathe through the mouth. Because if we breathe through the mouth, we're taking cold, dry air into the lungs, and that's going to aggravate the airways, causing inflammation of the airways, causing wheeze, causing cough, causing breathlessness, causing increased mucus. And I'm not just talking as well about the lower airways, I'm also talking about the upper. We can help both the upper airways and the lower airways by changing the breath. And the key with breathing is that breathing should be gentle, quiet, and light. Since nitric oxide is continuously released into the nasal airways, the concentration is dependent on the flow rate by which the sample is aspirated. Now, what I mean by this is that when we breathe through the nose and we breathe lightly and breathe quiet, we take a higher concentration of nitric oxide into the lungs. In the lungs, it sterilizes the lower airways, passes into the blood where it can perform the most important functions throughout the body. But, you know, also with breathing volume, it has been recognized that people with asthma do breathe too much, that it's not just that the airways, you know, of course, if the airways are constricting, you're going to feel that you're not going to get enough air. And that, of course, will contribute to, you know, that will increase your breathing volume, because when you feel slightly suffocated, you want to take in more air. But it's the increase in breathing volume that feeds back into the asthma. And this diagram here, which was published in the New England Journal of Medicine, it shows that airway hypocapnia, which basically means low CO2, is causing the smooth muscle of the airways to constrict, is causing increased amounts of mucus. So basically the airways constrict, therefore we breathe harder, but the harder breathing contributes into hyperventilation, which feeds back into it. That's the loop that we're trying to break. Now, the first aspect is switch from mouth to nose breathing. There's a very, very simple exercise to decongest the nose. And you literally take a small breath in through your nose, small breath out through your nose, you pinch your nose, and you gently nod your head up and down, and you hold your breath until you feel a medium to strong air hunger. You let go of your nose, you breathe through your nose, and you calm your breathing. You wait a minute, you try it again, and you do that 6 times. That will temporarily decongest your nose. When you get your breathing corrected, by doing breathing re-education, by resetting the respiratory center in the brain, by developing good breathing habits, your nose then will remain far more open. In other words, rhinitis and asthma, the key to it is get our breathing right. And we did a study I was the practitioner involved in a study at Limerick Regional Hospital in Ireland, and it was investigating nasal symptoms in patients with asthma. And it looked at 3 validated outcomes: nose, and also what's called a sinonasal outcome test, and also a visual analog scale. And for example, the nose validated outcome, it looked at how are the patient's nasal congestion or stuffiness. Did they have a poor sense of smell? Were they snoring? Did they have nasal blockage or obstruction? Did they have trouble breathing through the nose? Did they have trouble sleeping? Because of course there's a huge link between nasal obstruction and sleeping. Were they able to get enough breath in through the nose during exercise or exertion? And the results at 3-month follow-up showed that all of the nasal symptoms reduced by on average 70%. This was without medication, without antihistamines, without any intervention other than teaching the Buteyko Method. And basically we taught a series of different exercises, starting with decongest the nose, switch to nose breathing, and then bring breathing volume down towards normal levels. And then we looked at lifestyle aspects of it. So this was a profound, effect and improvement on the health of rhinitis. And rhinitis, when a child or an adult has a blocked nose, it's not just meaning that the nose is stuffy, because rhinitis is a condition that would be known as a comorbidity effect. It affects other aspects. So the nose is blocked, but then it affects sleep. The nose is blocked, it affects the lower airways. The nose is blocked, as a result we breathe through the mouth, and it leads to craniofacial development in children. In other words, it actually alters the shape of the face. So the child isn't as attractive and doesn't have as good sleep, has poor athletic performance, example. But this can come back to mouth breathing. So when we're talking about a stuffed nose, we're talking about a lot more than just simply a stuffed nose. In terms of asthma and the Buteyko Method, there's been 9 published studies about it, and all studies demonstrated significant reductions to asthma symptoms and significant improvements to asthma control, with a number of trials showing a 70% reduction in the need for asthma reliever medication. We can have people with asthma half their need for medication simply by changing their breathing. And the most recent study, it said, even though no study has indicated exactly why Buteyko is so effective at controlling asthma, if a drug could show these results, then it is likely it would be used widely in asthma control. So there is debate about what's happening. When we breathe through our nose, we do harness nasal nitric oxide. Nitric oxide sterilizes the air. When we breathe through the nose, we carry moisture into the airways, so there's less dehydration of the airways. When we breathe through the nose conditions the air to the perfect temperature. So on a very hot day, the nose cools down the air, but on a cold day, the nose warms the air. So the nose is not just the 2 holes in the face. Its importance is that Dr. Morris Cottle back in the 60s said it performs 30 functions in the human body. And for asthma, for respiratory complaints, for snoring, for good development during childhood, it's absolutely vital that we learn to breathe through the nose. Further information is available from buteykoclinic.com or directly from Dr. Mike Milligan. Thank you for listening.